I see we're live.
Okay, we got it.
How do you tell it's live?
Because you can see it says we're broadcasting on your computer. Do you see that?
No.
Oh, okay. Up in the left-hand corner, you can see like that symbol that's going like this, boom, boom, boom,
Oh,
boom.
like a Wi-Fi thing. Okay, got it.
Yeah.
Yeah.
Welcome to you and welcome David Kirsten, co-host of The Ripple Effect, among many things.
Thanks. Good to see you and welcome, Ash. I was just saying it's been a little while and I'm having you on. We're doing some new things with the podcast, so we're good to have you back and maybe put out a highlight or two. We're getting some more exposure on some other platforms by putting out some shorter clips. So Erica's drinking one of her smoothies. And yeah, I put the crib sheet in the chat. So
Hmm.
you want to lead us off, Erica, or you want me to?
Sure.
I have me leading us off, but we could really both do it because we know you've actually known Ash for longer than I have. But if you don't mind, just maybe
Yeah.
introducing yourself and telling us how you know Ash. And uh, I always like to
Okay.
start
Well,
out
so
with that.
hello to the Ripple Effect, amazing viewers, community. I'm Erika Gimbel. I'm a psychotherapist and I'm a fruits and vegetables advocate here in the Bay Area on Ohlone territory. And I am so happy that Ash is our guest today, Ash Aneja, health insurance agent. And we want to hear about your story and what services do you provide, Ash? Tell everybody. Ding.
Great. Hello, everyone. Thanks, David and Arika, for inviting me here. It's great to be here. And what I do is I provide health insurance services for the self-employed and or individuals and families, and for people who are on Medicare when everyone turns 65 someday, and then I can help them with their Medicare supplement and prescription drug plans. And then also, if they have a vision to grow their business, hire employees, they can help them with their group health insurance options. So initially, I started with a menu of everything, but because of my BNI network and my networking with other specialists, I thought it would be a better business thing to do is to be specialized only in health insurance and work with other specialists in other areas. So that's why I'm with BNI and get excited to work with other people and offer my services to self-employed or people who don't have access to health insurance from their work.
You tell us how you chose this. What of all the things had you picked this? Like I know you have an interesting story about
Yeah,
that.
how we got
Yeah,
into.
so go ahead, David.
Oh, I was just gonna say, yeah, how you got into health insurance. Yeah.
So when I started with menu of everything: financial planning, life insurance, long-term care, disability, and health insurance. It just so happened that health insurance is so volatile and people needed to talk to me a lot more than any other service. It just happened to be the one that chose me rather than I chose it. And then I decided, okay, it may not be worth my while to just spread my focus all over the place. Rather focus on health insurance and dig deep and help people with their health insurance options, no matter what their situation is.
Yeah, I already have a little wild card question, Erica, but because I actually, Erica and I, we know a lot of people in BNI as you do too, and there's a lot of insurance folks out there, but there's so few that do healthcare, and I really see that as such a sweet spot. They might do long-term care, but I find that there's a real need for small businesses, especially to get healthcare. So I was just curious, why there's such a what kind of makes you unique and why is the small business so underserved when it comes to healthcare, if you believe that is in fact the case?
So what I do is I'm a specialist. So this is what I do. So if there is anything going on within the health insurance world, I try to find a solution for a small business or self-employed person. And I think I have a finance background, so I look at insurance in from return on investment point of view rather than get the best insurance package that covers everything. That may not be the best way to get health insurance and not the most affordable way. So guiding people to evaluate that option, look at the return on investment, maybe a high deductible plan will be the best one. So I walk in with that message and I feel I have a different perspective from other people. Other people will, brokers may say that, okay, get the best health insurance option. That may not be true today, it could be true, but down the road, as the cost increases, it may not be true. So I look at from the long-term horizon and from return on investment point of view. And with that, the high deductible health savings plan, which I always talk about, is the way that I start my message. But one size doesn't work for all. So I cater the plans to whatever my clients want that fits their budget, their comfort level, and makes their employees happy.
Erika, you
What,
had that great question at the
yeah,
beginning.
yeah.
I wanted to
Yeah, so
have
thank you for that answer. And what's hot and happening in health insurance right now? Like what's hot off the press for you and your clients right now, or clients to be?
Well, 2024 has been a huge rate increase year for health insurance. It's so high, if it's higher than people's mortgage in their house. So they definitely have to look at what the options that I always talk about in BNI is a health savings account. Look at that even more carefully now, even with the subsidy, than ever before. So I bring that out, and this is an election year, so things may change. So we may have to pivot again. And I am there for them and guide them to future, whatever future brings. And the Affordable Care Act has been around for more than 10 years and been working with it, but it may not be there for future. So what is the best thing we can do as for a family or for a business so we can survive the change if it ever happens? And 10 changes do happen.
I
Yep,
was gonna,
indeed.
Mhm.
I was gonna
Indeed.
just say I love that background, Ash, how everybody who's ever driven over the Golden Gate, you have that fog, sometimes you just how many times have you driven over that bridge where it's like half fog, half sun? So
It's so amazing. Every time I go, it's so relaxing.
yeah.
I
Sorry, Eric, I
remember,
didn't mean to
no,
cut
no,
you
this
off.
is good.
We're both
I
excited to
you
have Ash on because we've known him for a while and it's been a while since we've had you on. So yeah.
No, it's good. You reminded me of a memory of going around on the bridge, running and walking on the bridge too. So it's fun if you ever want to do that.
Do you want to give some context to people about health insurance in our country versus other countries? Because I know you have an experience for the people in your home country, your original country. Like we are lucky to have health insurance the way we have it, and yet it's not cookie cutter. Yeah.
No, I still feel we have, regardless of the problems of the health insurance, we are very extremely lucky because once you have the health insurance package, you know what your limits are. That's the maximum you'll ever pay, and they will do everything to help my clients. But I lived in India and all my life, and we had nothing, with no concept of health insurance. You save for that negative event if it ever happens. And those things can happen in life. So no matter how much you save, if one event can wipe out family savings, that ruins the chances of saving for another house or a kid's
Yeah.
wedding or college. And also it's sometimes they forego care. They let go because they don't want to spend that money. And I thought that was very unfair system because it would help the rich and it will just people who couldn't afford to pay for those hospital bills just would forego care. So insurance to me is a blessing. It equalizes a playing field. Everybody pays in a little bit and we can take care of a family in different situations. So I've always found that insurance is a great thing. I've lived in country where we didn't have it, and I know it's totally missed. And it's the care is uneven. People who are rich and powerful can always be taken care of, but people who are not, they have to wait in line or make a choice to not to forego care. So whenever I talk to my clients, I pick up the phone. I do have that image in mind that I am serving my community by
Yeah.
providing health insurance. So thanks for asking me that. I do recollect.
I
That's
think
the
it,
reason I started health insurance.
yeah, it's sort of the big why, like
Right.
what's the heart of the matter for you? It's really good to hear you talk
Mm.
about that because it's like, yeah, why, what is this for you? So thank you. I appreciate that
I
answer.
just want to add, I was
Yeah.
just visiting my folks in India, and they're both in 80s and 90s. There's no health insurance. They have to pay for all their medical expenses but
Wow.
now India does have health insurance, but you can buy it after a certain age. So we deal with that right now with my family, and we have to pay for it. And those are the things that I feel we don't have to worry about here, whether it's Medicare for people over 65 or the regular individual health insurance for people under age 65. We have it pretty well covered. The only question is the affordability, and that's what I do, is to bring the best way to get it, so you can afford it for the long period of time.
Thank you.
Mm. Thank
And you can't predict the future. You don't know what's going to happen with health insurance as we go into this next election cycle. And are if we stay with the president that we have now for the next term, will things kind of pretty much stay the same, you think? Or you can't even predict that?
No, I think if there is a change in administration, there would be a change in insurance. But if there is no change, there should be a change. I tell you why. Because yeah, we have a good thing. Everybody gets health insurance, no pre-existing conditions. There is subsidy available. People at different levels of income. But on the other side, there is no incentive to save. Like if you are a good driver, you get a discount on your car insurance. If you are a smoker, you pay the same as non-smoker nowadays. If you don't have a good, healthy lifestyle, you pay the same as a person with a healthy lifestyle. So there's no incentive to save in this existing system. I think that needs to change. So there should be, like any other product and service we ever use, we get rewards for things to do it right. Here, it's not built in the system, and I think that needs to change down the road, whether there is a change in administration or not. Otherwise, the cost will just keep going higher and higher.
Wow. Yeah. Well, let us hope and pray and let's vote.
Yes, yes. And well, also as a business person, you have to plan it regardless of the situation, how I can help my clients. So either way, we can help pivot to whatever life brings in future.
Yeah, I think the big thing to know about is a lot of it's state too, and how the states handle the federal law. So Ash can really give you the latest because everything's always changing, and that's why he's so unique in this field. And he's such a straight talker too. He can give you the latest in a quick conversation if you're
Yeah, I
a
really
business owner. Yeah.
appreciate Ash for how, he's able to serve the individual with the questions. And then, yeah, if someone's creating with multiple employees, that he can create a plan that works for the group. And that's a really great way that they benefit from it's a more discounted plan. Is that right when you have a group?
It could be. And also in the group, you can break it in employees only, have the families go individual. So you can do various things to help out the employer and the families too, because if there is a contribution from the point of view of the employee, they have to look at, okay, shall I go individual in the marketplace or shall I go group with a small business? And I do that analysis for them to see what's the best way. So everyone gets the best deal.
Great.
Yeah, I'll just say, Erica, Ash, we are pretty good on time, but there are a couple categories here I wanted to get to 4 and 5 because I'm looking at putting those as
Yes.
short clips out. So yeah.
How has BNI helped your business, Ash?
BNI has been amazing. I wish I met BNI years before when I started my business from the very first day. Sometimes I get a visitor and they're starting a business, and I say, you're doing the best thing to join the very first day." So I joined years later. I think I'm, as a individual member, I'm okay, but I'm no match to a team of 25 to 30 members who are my sales force, who are my education team, who are place where I can feel to experiment with different ideas with my weekly infomercials, periodic presentations, and that all BNI provides me. And with time, you have friendships. So it's been an amazing place where I can
Yeah.
blossom and learn and create friendships. And as I said, I met years later, but I love BNI for
Yeah. And
what
for
it
those
brings.
people who don't know what BNI is,
And you tell us.
we should say that it is a networking group that meets weekly, and we get to know, like, and trust each other and think of each other when there's a need. Like when one of my clients says, "I am so frustrated with my health insurance right now, and I have a question," and I can say, "Okay, just call Ash. You'll save some cash."
Thank you for that.
That's your tagline. And but that you've really helped advise, educate. You come from a education point of view as opposed to just buy this, just buy this. Like it's very from a place of what serves. And I appreciate that style.
Thank
Yeah.
you. Yeah, I'm looking for the long run, not just this month, but maybe what will happen a year, 5 years, 10 years down the road to the same health plan. How would you be able to afford it?
That
Exactly. So can I ask this question, David?
sure.
So do you help people? It's kind of like that first person I was sharing with you about that I referred to, like there's a lot of red tape in health insurance, and you help navigate the red tape. Yes.
Yeah, so there's paperwork needed. I help them sort it out. There could be income certification, proof of citizenship certification. But remember, I've been used to doing 6 pages of paperwork when there was no pre-existing condition. So now the paperwork is actually smaller, more efficient, is
Thank
online.
goodness.
And yeah, it's all good. So
They made it more streamlined.
streamlined and faster. So I think it's much easier to handle. And I try to get on top of things right away, not wait. And that's what I tell my clients. Okay, if there's any paperwork due, let's do it today, even though they're giving you 90 days to do so.
Amen.
Mm.
Awesome.
Well, let's end with Ash, and this might be a little bit of a recap, but just in a short quip, who is your ideal client? Who are you looking for to work with out there?
My ideal client would be a self-employed person who is either starting their business or maybe terminated from their employment, now starting their business, either way. And they have a family, and down the road, they may need Medicare supplement, or they have a vision to grow and want to grow their business and hire employees. I've been fortunate in my life to have a few of them, starting with one person in their home, and it grew up to 70, 80 people. And they all from that one particular client. My goal is not to have those big numbers of employees. My business is catered to 1 to 20 people. That's my a place where I think I excel at. But that's what happens if I work with small business, a self-employed person. So to answer your question, anyone who's self-employed, starting their business and have a vision to grow, that is my best ideal client.
Very cool. And do you want to share what is your idea of a good time when you're not working on health insurance?
Oh, yes. When the work stops and my work is individual, I feel I like to connect with humanity. And I do workout and acro yoga and dancing that makes me be social, get me out of watching too much TV, sitting too much on the couch, eating too much, drinking too much. Just get out and be social and be with the humanity. And that really clears my mind. So the next day I can focus again. I think for me, that is the best way to keep moving forward.
Yes, I love that about you, Ash. And one of these days I'll bump into you at acro yoga or tango. And so you may see Ash, the dancing person, out and about. So thank you for sharing that.
Would love to share whenever you
Yeah.
and David want to join.
Great.
Yes.
And I'll put the links to your website and maybe your LinkedIn um on in the comments. I also might share all the link where that great video is that we did with you. You were so good on video, telling your story with the great short video. Yeah.
Oh, thanks. Thanks for you. You have a way to get me out and express myself. That was very good, David. You put some time and effort in setting up that video. That was very good.
Perfect. Yeah, if you do it well, they're almost timeless. It can last you a few years at least. So, yeah.
Right, right. But I'm always up to updating message when as whatever you recommend, or it's a good frequency to do so.
Great. Yeah, well, we'll get this out. And like I said at the beginning, we were going to put out some shorter clips. So look for those, folks, and we can talk a little bit more about that offline. But thanks for joining us on the Ripple Effect. Did you have any closing comments, either you two, before we sign off here?
I want to thank you, David and Erika, for uh, doing so much for the community and small businesses. And I would not be here if it wasn't for you. And thank you so much for always putting up the effort and trying to get the best out of people. And yes, I'm here for health insurance. If anyone wants to talk to me, whether it's self-employed, Medicare, or small businesses, I'm here to help. And like Erika said, you can call Ash and save some cash.
Right on.
Perfect. Well, it couldn't
David.
not going to get it any better than that. So, thanks for joining us, everyone. We'll see you next week on the Ripple Effect. Bye, guys.
Bye.